Hi, welcome to our webinar. I'm Dr. Daniel. My specialty is combining Western and Eastern medicine to help our patient reverse chronic disease. What I would like to share with you today is we work with our medical team, our surgeons, help our patients address the knee and lower back problems and help them avoid surgery as much as possible. So let's talk about the content we're going to have today is that how we can avoid lower back and knee surgery. So that's our medical disclaimer. All those information are referenced, not using as a diagnosis. This is a surgeon, Dr. George Camille, one of the top surgeons in Houston. We've been working together for quite a few years, successfully helping many patients with knee and lower back pain. And myself, the training is in conventional and Eastern medicine and the stem cell therapies. And that's my certificate. It took me about 6 months to finish all the 12 tests in terms of cellular therapy. And this is one of the top credential in cellular therapy and also credential in pain management. Work with the state government. I've been working with some medical centers and hospital, MD Anderson and Methodist Hospital or Susan Komen Foundation. So my focus really work on address the root cause of the chronic disease and help our patient reverse the chronic disease as much as possible, including if you look at here, this is our the professor who were talking about stem cell therapy at our annual meeting 2018. This is the two Nobel Prize winner, very famous in stem cell therapy. So our team working together, if you look at here, so, Dr. Tama, Dr. Phoenix, and Dr. Xiu Yinzhou, all three are trained in China in both Western and Eastern medicine. We have our experts in stem cell therapy, Dr. Neil Gordon, Juan Carlos, and Jeannie Burgmeister, our education directors. So the power team combined Western and Eastern medicine for treating not just the symptom, also address the whole person's problems. We also work on the cosmetic and the yoga and Tai Chi together. If you see, that's our location. We're in this T-Mobile building on 59 and West Lane, very close, just next to the Houston Art Institute or Greenwood Plaza and Galleria area. Let's take a look at this case. So this patient, 68 years old, face problems, a big problem, lower back pain, and the tailbone pain. He always carry a pillow with him wherever he traveled because it hurts him so much. And he had erectile dysfunction for 15 years, zero function at all, fatigue. But with our treatment, integrated Western Eastern medicine treatment, what he has, see that he got more than 80% improvement. Here he is.
Hello, my name's John, and for years I suffered from a lot of the ailments that WeMed treats. And one of them was chronic back pain. And that back pain, I didn't realize how bad it was until WeMed started treating. The other thing was I had a weightlifting injury that had permanently bruised the coccyx. That's the very lower part of your backbone. And after stem cell treatment, that's going away. In fact, I'm sitting in a chair now that I couldn't sit in without a prosthetic pillow. The third thing, and Dr. Yo said that nobody had ever spoke about it, but hey, it's real common, guys my age, is ED. I've had that since my mid-50s, and thankfully, WeMed has defeated the ED in my life where it's not conquering me 100% of the time. So I suggest that you take a shot and do what I did. Sign up for the program and get better.
My name is Jeannie.
Okay, so what you can see that he has so many problems, lower back pain, arthritis in lower back, and tailbone pain, functioning now. He's seeing great results. And his wife had arthritis all over his body. There's arthritis in the hands, in the knee, in the back. Now the pain all gone. So they both don't need surgery. Now, so the roadmap today, what we'll talk about is about, first of all, we'll talk about what are health problems and what are the arthritis. And then we'll talk about how American address those problems. And then we compare with our women, our solution, combined with Eastern and Western medicine. So let's talk about the facts. This is the lady, 81-year-old. What problem she has? She has a memory problem, essential tremor, hyperthyroidism, chronic fatigue, fibromyalgia, lower back pain, explosive diarrhea because the arthritis in lower back, which is compressing on the nerve. The nerve going to the rectum is not functioning at all. And he cannot sleep also. Even incontinence, you can imagine her life is miserable. That's her. But now she's doing so much better. We'll take a look at her story later on. So what are health problems when we get older? If you look at right here, number one, so based on Center for Disease Control and Prevention, the number one problem if we are age over 65 is arthritis and pain, heart disease, cancer, diabetes, sinus problem, and asthma. So those are problems. And if you look at here, why we have so many health problems when we get older is because your mesenchymal stem cell in your bone marrow decline dramatically. This is the newborn, how much it has. Now you're 50-year-old, and less than 35% left. So now you can ask the question, what do you mean stem cell? So, well, I'll tell you that. Think about yourself. If you are born, you're born with about 8 pounds, now you're 140 pounds. Why you grow? How did you grow from 8 pounds into 140 pounds? Exactly. That's because the stem cell in your bone marrow come out, differentiate more bones and tissues, muscles. You keep growing and growing. You reach 35-year-old, then that growing gonna stop. So what you see here is that how did they find the stem cells? Because of the atomic bomb exploding in 1945. As you know, many people died instantly, but more people died after. What happened is because of the radiation killed, you're right, killed the bone marrow. So here's the exact story of what happened. Your mom pregnant, that's the fertilized egg. That egg can be well divided in for 5 days. It's called an embryo. This embryo actually we can take it out and freeze in our office in the cryo tank for 5 years or 10 years. 10 years later, we can take it out, warm it up, and wake them up, implant it in different women's uterus, growing the baby. That's exactly right. That's amazing, no? So when the uterus, in the uterus, the baby keeps growing, going to fetus, and once it's born, from 8 pounds, it gradually, because the bone marrow stem cell will keep it growing to adult. Now, once the baby is born, the umbilical cord and placenta used to be treated as medical waste. Now, they are extremely important resource of stem cells. So these are very, very important mesenchymal stem cell. We can utilize this kind of stem cell instead we use the fetus stem cell, which is illegal in the United States. So we use umbilical cord and placenta stem cell. We can inject into the knee, regrow the cartilage because it differentiates your cartilage, your bone. And also we can IV into your body to help you repair your heart, your liver, and many organs functions. Isn't that amazing? That's exactly right. So what about, why don't we use our bone marrow stem cell? Yeah, that's fine, but because when we get older, this number of stem cells are going to reduce dramatically. If you take a look right here, 80% your stem cell in your bone marrow are hematopoietic stem cell. They're going to reproduce your red blood cell because red blood cell only survive 120 days, and white blood cell 3 to 12 days. So your systems, your blood cells are replaced all the time, renewed all the time. What about the 10% stem cell? The 10% stem cells to keep your body alive, because your skin cell, the mucosa cell only survive 30 days. Liver cell 180 days. Am I following? You got it? Yeah. That's what happened. So your cells actually, even your heart cells, your kidney cells, they are replaced gradually, step by step, all of them. So you gotta have the stem cell well in your bone marrow. So why we have arthritis in the knee and the back? Because look at this. If you look at this back, this is the lower back, it's a disc. Remember, your mom says that now I shrink 3 inches. That's exactly what happens here. The disc getting thinner. If you see, look at this 80-year-old bone, and this is the 45-year-old. Can you see the big difference? Disc right here. That is the reason this person has a lot of lower back pain, because the nerve can be pinched and inflamed. What about, so how do we get lower back pain? Of course, it could be the muscle achilles, or could be between the vertebrae, you can see the ligaments right here, or because the arthritis, or it's because you can see here the herniation of the disc. The disc could herniate right pressing on your nerve root. It's going to have sciatica or other neuropathy symptoms, or it can press on the spinal cord, and then having other different stories. Or it could be the muscle problem. So as muscle, you can see right here. So to treat back pain, number one thing, your doctor can be well educated in, they can identify what exactly the cause of your back pain. A lot of back pain, we can just take some pain medication, or massage or acupuncture or steroid injection will be very helpful. But some situation, they have to be helped by stem cells to regenerate the tissues and restore the space of the nerve. If you look at the arthritis right here for this knee, I know it's terrible. It's bone on bone. Same thing this one. If you look at this hands, those are the arthritis in the fingers. You can see the space disappear. Then if you look at this in the normal hand, you can see the cartilage still there, nice and clear. So that's we call arthritis in those joints. You're losing cartilage and almost close to bone on bone. That's the reason the doctor told you you gotta have surgery. But if you still have some stem cells, our medical team can check it out, evaluate. Hopefully, we can help you regrow some of the cartilage, and then you can avoid surgery. These are one of the examples of our patient. Are you ready? So this patient, we took a picture the first day came in February 11th. If you see the medial side here, the meniscus is totally gone. Then we give him stem cell injection at June 13th. So our medical team take a picture again. You can see the meniscus regrow right here. Now you can see it's a very, very significant change. That's the reason he was very happy. It was granted with a certificate that he successfully finished the program and avoided surgery. Congratulations, Mr. Regenerative. So in terms of for arthritis and chronic pain, our solution in the United States is right here. We do spend a lot of money in the United States, about $10,000 average each person. In India, they only spend about $200. And at the same time, also a lot of patients are taking so many medications. All the medication approved by FDA, but at the same time, then FDA later found out some of the medication should be removed from the market, like Darvocet, Vioxx, and they actually increase the heart attack risk, or even Nexium and antacid to treat the acid reflux. You see here, they actually increase risk of osteoporosis, memory loss, and anemia. What about the hormone replacement? We already know that estrogen therapy, like estrogen progesterone therapy, they actually can cause what? Yes, they can cause breast cancer or ovarian cancer. And testosterone therapy has association related to prostate cancer. And by the way, how many of you are taking Benadryl? Well, I know you're taking, if you're taking Benadryl, antihistamine, antidepressant for a long time, what's going to happen? They found out that actually more than 25% of the patients, they develop dementia. Listen, this is what happened. So they follow up with age 65 patients, about 3,500 of them. Well, they find out 800 of them develop dementia within 5-year period after taking antihistamine like Benadryl, antidepressant, bladder medication regularly. So that's very, very scary. Now you understand that. American solution for pain, for knee and lower back pain, besides the medication, injection, we utilize surgery. But now we do far better scientific technology. We utilize stem cell to regrow the cartilage. Hopefully can help many patients avoid surgery with our medical team. So our office is different. Our office will focus on East and Western medicine, find the cause of the problem. The step one, when you come into the office, we're going to spend about 45 to 1.5 hours to check out what's going on with your body. We'll listen to your top 5 health concern, and we'll examine you from head to toe, we'll review your medication, medical histories. Then at the same time, I'll do narrating and nerve examination. If we need X-ray, we'll send you to X-ray. So we spend a lot of time to understand what's going on with your body. And second thing, we also need to find out your nutrition status. What food you're not digesting very well, and what food intolerance and nutrition deficiency you have, what heavy metal sensitivity is causing problems. So, or even we can do genetic testing to help you find out what will be the best nutrition to help you. Another thing we do also do gut health. As you know, happy gut, happy life, happy life, as you heard about that. So we need really analyze your stool to check out your positive and negative gram bacteria, how they to each other. We have parasites and all different things. So that's extremely important. All we need to understand your cortisol level and your hormone change. And step 3, what we'll do is we'll also design specific exercise and fitness program, customize the program for individual patients. And number 4, we will utilize natural medicine such as Eastern and Western medicine. I'll use acupuncture, we use stem cell therapy, and you can see here, acupuncture is a godsend for many. Time magazine, which is in 2010. So personally, I was Dr. Michael DeBakey's acupuncture doctor. He really loves acupuncture. He even went to China in 1972, witnessed the Chinese used acupuncture anesthesia on these 2 patients. These 2 patients, both they did not have medication, no anesthesia, and they just had acupuncture. So during the surgery, both patients are weak. They can talk to Dr. DeBakey. Can you imagine? Yes, that's the power of acupuncture. Besides that, you can see here, acupuncture has about 1,200 studies going on right now. You can just go to the government website, clinicaltrials.gov, to find out. And the World Health Organization has amazing recommendation about acupuncture in 2002, which is acupuncture, the mechanism to focus on your nerve system circulation. If you see the flower right here and flower right here, so you can see the difference. This is Pentagon utilizing acupuncture for our soldiers to treat their PTSD, anxiety, and insomnia. Talking about the lower back pain, they did one research right here with over 1,200 patients. So they have traditional acupuncture, conventional medicine, physical therapy, exercise. They did treatment for about 6 months, then they stopped treatment for all the group for 6 months without acupuncture. 6 months without acupuncture, 47% patients still doing great. The lower back pain is not bad at all. And then conventional medicine group is 27%. So you can see the difference. So in conclusion, our advantage in our office is we're not just treating the symptom, we also work on the whole body, get this person well. So step 1, you work on nutrition. Step 2 is, see right here. Let's see here. Okay, so step 1 is work on the nutrition. Step 2 is work on the exercise and the customized fitness programs, balanced hormones and spiritual health, and then we use Eastern and Western medicine together. So the regenerative medicine right here, you can see that when you're young, everything's happy. Now you have quite a few things breaking down. With the stem cell therapy, you can help replace a lot of the damaged tissue here. As you can see here, again, that's the first egg and embryo, and then that's the fetus, and the placenta and the umbilical cord. They have a lot of mesenchymal stem cell. When you're born, your bone marrow starts continue growing, dividing, replace, renew all your cells in your body. So the reason we use umbilical cord stem is because they have tons of healthy cells, no rejection at all. What you're going to see here is how stem cells work in your body. So you have stem cells circulating in the body all the time. Whenever you have inflammation, you're going to release chemokine, cytokine, and those are the chemicals attract your stem cell there to differentiate, and you can see they fill the gap. The problem is that if you're older, this gap may not be healed completely. As children, you can heal much faster. So, because when you're born, you have this much stem cell. Now, age 50, you have this much left. Now, you're going to be curious about how the external source of stem cells go into your body, where they home at. Okay, normally, whenever you have inflammation, your stem cells are going to go there and fix the problem. But when you're getting older, they don't fix completely. It's like a COPD, the lung problem, liver cirrhosis. They're not able to fix all the problem. That's the reason you have the chronic disease going on and on and on. So this is research to show you that they utilize the FDA-approved substance. They tag umbilical cord stem cell before injecting IV intravenous into this patient, and then they take a picture 48 hours later. 48 hours later, you can see this person have a lot of external source of stem cell in the right hand, bladder, the lung, and the thyroid. How so? Because there are inflammation, arthritis in the right hand, in bladder infection, COP in the thyroid. There's no infection, inflammation or arthritis in the knee, in the ankle, in the left hand. So they don't go there. So now you understand whenever there's inflammation, it's going to be attracted to the place wherever you have inflammation to fix the problem. Great. So in first conclusion, you can see that if you IV this person, you think if you have a thyroid problem, if you have hypertension, congestive heart failure, diabetes, so a lot of those external sources are going to accumulate into those sick area. They're going to help them and help them recover. That's the reason they get anti-aging, get healthier. So you may ask the question that, yeah, when I went to the high school reunion, everyone look at me, says I look great. So what happened? Because I eat well, I did my exercise, I avoid infection, going to the hospital, and handle my stress well, I avoid most medication. That's the reason my stem cells still preserve better than him. Got it? That's it. So in order to be healthier, we've got to work on all those areas. Because if you're a baby, you have this much stem cell. If you sprain your ankle, you take only 3 days to recover. Now you're age 60. How many days for you to recover for a sprained ankle? 3 months, possibly. So you can see the huge difference. That's the reason when we adding extra stem cells in the body, we have extra stem cells to fix the body. So that's the reason it works wonderful. Now you also understand to see, are they safe? Yes, they are very safe, and we have to report to FDA for each injection of a stem cell therapy. And this is the report that shows that there's no rejection, sound scientific evidence. And in the second conclusion is that stem cells, with our programs, we are able to help regenerate tissue, the bone, the cartilage, and then arthritis, and the nerve systems, and diabetes, thyroid problems, kidney problems, autoimmune condition, like Crohn's disease, lupus, psoriasis, eczema, and anti-aging. Well, anti-aging, if you see right here, that's the father of Mel Gibson. If you look at this picture, he was 92 years old. He had non-kidney heart failure. The doctor said that he has only about 6 months to live. Now, because what happened is that one of our scientists, Dr. Neil Rorden, gave him stem cell therapy, and this is his 100th birthday. You can see his anti-aging result is quite impressive. And the research shows that with the stem cell therapy, it shows significant improvement for the heart, and there's no adverse events reported at all. And there's no antibody produced at day 0, day 19, day 15, and day 90. There was no antibody produced to attack the umbilical cord stem cell. So the gift for today is that our webinar guest is that we're going to call you immediately. We'll ask you what's your health concerns and then what's going on. We'll try to help you identify if you need help or at all. And besides that, we're actually going to provide you a gift right now. So what the gift we'll give you today is that because you spend time here and we want to show you, we're going to help you. We'll find out what's the cause of your health problem. So number one, we invite you to our office for a 45 minutes to 1.5 hour consultation, which include you can tell us your top 5 health concern, what medication and medical history you have, and then we're going to examine your nerve and circulation and ratings, joint examination, and adrenal testing. We also will do 1 X-ray shots to see what's the cause of your problem. So we're going to give you a plan of action, the cause of the issues. So the regular fee for this whole examination will be $247. So all of our patients, all the new patients, when they make an appointment to become our new patient for the first visit, they have to pay the $247 over the phone to secure the spot because we're very busy. For all of you today, we actually set aside only about 3 appointment spots to accommodate so many guests today. So what we're going to charge you, we'll only charge you $47 instead of $247. That's our huge gift for you because with this all the same things going on, first of all, we have help you remove your financial barrier. So in addition to that, if your family member and friends need the evaluation, they only also pay $47. All you need to do is just call our office right now and get the appointment and pay the $47 security appointment for you. You'll get all the testing and what it's gonna cost. After that, how much it costs, you will decide, and we won't charge you unless you decide to really, you want to improve your life or treat the cause of problems. So let's close up. If you look at our results, then you'll be so confident that, okay, now I understand we MedHealth, they work with your doctors, and we work with Western Eastern Medicine together. Talk is cheap. Let's see the results. So overall, we help about over 1,400 patients, 700 patients knee problems, meniscus problems, MCL and ligament, medial collateral ligament problems, ACL problems, and all things. There are 94% improvement at month 6 and 8. 385 total knee replacement avoided. Another 700 hip, shoulder, neck problems, and they're doing much better. So why most of our patients are pain-free or avoid surgery? You probably see that some of the reports, some of the research reported for knee problems, only about 30%, 40, 50% patients get better. But our patient, more than 90% are doing much better because we have that after program. So we're going to work on this patient nutrition. Make sure we work on with their lifestyles, and we utilize acupuncture and also use platelet-rich plasma to enhance the results of knee problems altogether. So we have assurance program, and our surgeon, Dr. George Camille, is an amazing doctor. And we do have specific equipment to utilize to use, and that's our scientist, Neil Gordon. It's an amazing doctor. So in conclusion, if there's no system to follow through with the stem cell, it's just like you plant a tree. You don't take care of the tree, you know what's going to happen to the tree. Hopefully it will grow, but most of the time it won't. So we have an after program to come up together, make sure you're successful. So this is one of our patients. His name is Mr. Spano, 52-year-old. He's a veteran. He was blown up by landmine in Kosovo. had 11 surgery on his back. 7 out of 10 all the time. Leg pain, hand pain, and foot pain, overweight 259 pounds, cannot sleep, PTSD. He was dragged on the ground by a car 30 feet, super fatigue. He was 70 years old, and zero libido, 100% disability. So his life is miserable. With our help, within 6 months, most of the pain was 90, 80% better. He lost 50 pounds. PTSD, more than 20% better. Sleeps better. Libido is good. Now he has 0% disability. Can you imagine it? And this is another case you can see here. You see the knee right here and here. Can you see the big difference? So his left knee all right. Our right knee is the problem right here. Rotting bone, and now you can see that the knees can grow, and he's very, very happy. So if you look at the knee right here, that's the difference here. So with the knee problem, if you have tear of your ligaments, as long as less than 50%, you still can utilize stem cell to help. Without stem cell, you're not going to heal very well at all. And this is the meniscus. You can see that. That's the gentleman. His name here.
Great. Thank you. Why you're so happy today?
Hey, I'm so happy because I started my treatment. I came here for 3 months. One of my friends recommended me, and I am fully diabetic, type 2, and I was having the serious problem for my knee. My cartilage was totally damaged. I was unable to walk, and then when I came here, I started the treatment here. And after 3 months, today I am feeling only better. I walk. I can't run, but I walk very nicely, smoothly. And yesterday I got my blood report. My diabetes was very good. A1C was 9.7. Before it was 9.7. Right now it's 6.2. My lipid profile is good. Right. My creatinine is good. SLT is good. So I'm so happy. Thanks to Dr. Ping.
Oh, you're welcome. That's all.
And all Ping, yeah.
Yeah, you did a great job.
So he's very happy. And one of them talking about here is, yeah, you have to take action. So how much that cost? The cost of them. So we have a 3 program. Number one, you can just come in for acupuncture or utilize amazing acupuncture to help your pain, help you sleep. But some patients, they have diabetes, hypertension, liver problem. Then we'll check out our nutrition status. We check out the gut flora. We'll work on the hormone. So the whole wellness program to help this patient get rid of more than 50, 90% of the problem. So that's a wellness program. All we can utilize is stem cell therapy. The stem cell, particularly for the patient, has a lot of tissue wear and tears, lower back areas. So the first unit of stem cell is $5,300. Any additional stem cell unit will be $900. With that, it also includes we have after program to make sure you're doing well and much better. So that's very, very a strong assurance for our patient. Of course, you can use, we have finance available, 12 to 18 months, zero interest. Or you can use a health saving account, and you can have a payment plan. Now, the insurance only covers stem cell treatment for cancer patients, or for all the problems they don't cover. But think about this. If our treatment can help you avoid surgery, how much time you can save, how much money you can save, also how much out of pocket you can save as well too. You can see the amazing benefits behind that. Plus, we have after program and then work on your overall health. So definitely it's something amazing value right there. So you saw the lady, she had a problem a moment ago. With the lower back pain, what you see here is what you just saw a moment ago, you can see all the changes right here. So you got to find the root cause of the problem. What is causing the problem? Is it nerve, arthritis, herniated disc, psoas muscle problems? Look at this patient. The L5S1 is almost bone, and then after stem cell treatment, and you see the difference right here. So that's the huge difference you can see for this patient. As long as we can help this patient, reduce the pressure on the nerve, you know what's going to happen. That's all.
Good morning, Miss Eva. How are you doing?
I am doing so much better.
What happened?
So she's doing amazingly better.
What?
How much better? What you can see right here. So her memory from 2 increased to 5 out of 10. Improved. Essential tremor was 6, now dropped into 3. Hypothyroidism and energy was 1 out of 10, terribly tired. Now it's 8. Fibromyalgia, pain, 7 out of 10, that's 1 out of 10. Lower back pain, 9, that's 0. Digesting, intramuscular explosive diarrhea, due to neuropathy, 8 out of 10, now it's 100% better. Sleep, 100% better. Incontinence, used to use 4 or 5 diaper a day, now she only uses 1 diaper a day. Depression, 8 out of 10, now 2 out of 10. So, in conclusion, is that you got to take action, and that's our gift for every one of you. Thank you for coming to join our webinar. Once again, our gift for each one of you is we're not gonna charge you $247 for your first visit. You only pay $47 for yourself, and $47 for your family member. What we'll talk about is your top 5 health concern. We'll review medication and medical history, and we'll also check your nerve and blood circulation. We're going to check your joints at the same time. So the whole visit is $247. Our new patient is supposed to prepay over the phone to secure the appointment. For all of you, you only pay $47. It's an amazing value for all of you because we want to help you to check out the cause of problems. And we do set aside about 3 appointments today. Go ahead, this number 713-572-3888. 713-572-3888. Call our office and we can give you an appointment and we can check out what's going on with you and have a great day.